Hello, I'm Dr. Brandt Gibson, and I'm a little late tonight, but I wanted to make sure that you had the information that you needed for the next step. So, tonight I want to talk to you about one way, one, I guess, portion of the ways that you can actually treat uh, ingrown toenails. So, we've already talked about what an ingrown toenail is. We've already talked about what your options are to treat it at home. Um, so, the next step is if you were to be seen by a doctor, whether it's someone that specializes in the foot and ankle, or whether it's just your primary care doctor, or even the emergency room, or so forth. There are multiple ways that an ingrown toenail can be treated. It is important that you understand what's being done. So there are three questions I want to make sure I answer before I get into this a little bit further. But number one is, do you need antibiotics for an ingrown toenail? Most of the time, typically you do not. A lot of times you can actually treat the ingrown toenail. You remove the offending nail. You don't need the antibiotics because it will resolve without those antibiotics. Number two, what way is it going to be treated? There are two options when you're treating an ingrown toenail. One is a temporary, one is a permanent. We'll talk about a permanent later. We're not going to talk about it today. And the third option is how often does this individual treat ingrown toenails? Because if you're going to get treated for ingrown toenails, the ideal would be to get someone that does it all the time. And the goal is to have someone that really knows what they're doing. So when they're saying, okay, we're doing a temporary or we're doing a permanent or whatever, you know that they actually know what they're talking about. So there are really several different ways that you can do this temporarily. So an ingrown toenail, as you remember, is the nail growing into the skin. There you can do a temporary, which is called just a slant back, where you just take a portion, just a little piece of that nail, that corner out, so that it doesn't cause pain. That is truly temporary, and a lot of times will cause or will alleviate the symptoms and cause it to be pain-free for a period of time. But a lot of times over a period of 1 month to 3 months, you'll actually get the pain back because you haven't fixed the problem. So a slant back is one. Number two is you actually go ahead and get the anesthetic, and this is common outside of an office that does these all the time, but you get the anesthetic and they'll trim the nail out and tell you, okay, that's good enough. This should solve your problem. The problem with that is the nail will grow back. If you don't do anything to stop it, it does grow back. And that's also a form of temporary treatment for an ingrown toenail. The third way that's sometimes done is they'll do that. They'll numb the toe up, they'll take a piece of that nail out, and then they'll use a cautery or something similar, whether it's just silver nitrate or something to stop the bleeding, and they'll talk about it as if that is treating an ingrown toenail permanently. Whereas truthfully, if you're not doing any damage to that nail bed, the nail will typically grow back and sometimes could even be damaged from the way that you actually treated it in the first place. So if you're getting the nail treated and they're talking about doing it permanent, you want to make sure that they can tell you what they're doing that's causing that portion of the nail plate to never grow again. And they should be doing some kind of a chemical or physical damage to that area. So that's what I will talk about tomorrow. But tonight, basically, one of the ways to treat ingrown toenails is to do it temporarily, which will do less damage to the nail and allow it to come back exactly how it was. The problem with that is a lot of times it comes back exactly how it was, and you have the ingrown toenail back over a period of time. So if they do the numbing and they take the whole nail out, you may get 6 months to a year before you have an ingrown toenail again in that area, but a lot of times it does come back. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 213, temporary treatment of an ingrown toenail. Thank you and have a great night.